So every one of us has gone through the Cal Poly orientation, and we all sat through the same speech promoting condoms. Our school puts a lot of effort in making condoms easily available for its students. For instance, when you go to the health center, you can get 10 condoms for only $1. Also, the Wellness Center Facebook group encourages students to join its group by offering them 6 free condoms if they join. Condoms are also sold at the Commons, Vista Cafe. I don't know how many condom machines are on our campus, but I know there's one in my laundry room in the dorm I'm in. So basically, if you need a condom, the school makes it pretty easy to get one. However, there's a lot of controversy on making condoms easily available for students. Many feel that making condoms easily available encourages students to have more premarital sex, which is considered immoral by many people, especially those with religious beliefs. And because condoms, supposedly to them, promote sex, they believe it also may increase the spread of STDs and unwanted pregnancy. So, however, in this speech, I will be making the claim that making condoms easily available does not promote sex and decreases the spread of STDs and unwanted pregnancies. To support my claim, I will be discussing a study comparing the experiences of several thousand students in New York City where condoms are available as part of the AIDS education program, with the experiences of students in Chicago where condoms are not available in schools. So basically, they're going to be comparing these two places. So first, I'll be discussing the study's statistical findings on subjects such as sexually transmitted diseases, rate of sexual activity, and rate of condom use. Making condoms available, my first point is, making condoms available in schools does not increase students' rates of sexual activity, but does result in higher rates of condom use among students who are already sexually active. First, I'm going to discuss how the study was conducted based on an article that cites a study published in the American Journal of Public Health. The study looks at 13,000 public high schools in New York City and Chicago. New York was chosen for this study because the Board of Education implemented the first condom distribution program in 1991. However, Chicago was chosen because it's a large, unified, urban school system similar to New York's. And it has the public schools are diverse, high dropout rates, and provide students education on HIV and AIDS, but not condoms, which the New York schools do provide education on. The participants of the study are grades 9 through 12, and they categorize the students by either new students, which are students who have been enrolled in the school for less than a year, or continuing students, which are students who have been enrolled in the school for more than 1 year. In both cities, there's a 47% in both cities, 47% of new students and 60% of continuing students are sexually active, and their sexual activity increases as they get older. So here are the statistical results found in the study. Sexually active students in New York, where condoms are made easily available in public high schools, were significantly more likely to have used a condom than the sexually active students in Chicago, who do not have the same access to condoms in their public school. So the continuing students in New York, the students that have been enrolled for more than a year, in New York, higher rates of condom use than in Chicago. There's a ratio of 61% versus 56%. The new students in Chicago and New York were equally likely to use condoms, and the ratio is 58% to 60%. High-risk participants in New York were almost twice as likely to use condoms than high-risk participants in Chicago, and the ratio is 1 to 9. So basically, this study shows that because new students in New York were not used to the condom program, they're more likely to behave like Chicago students and were less likely to use condoms. So, additionally, this study affirms that making condoms easily available does not promote sexual activity. There's a logistic analysis examining factors affecting the odds of sexual activity that revealed no difference between continuing students in New York and Chicago. So basically they had the same sexual activity rates. So based on information given by a credible government source, the Centers for Disease Control and Prevention, the increase in condom use decreases the spread of STDs and unwanted pregnancies. So when condoms are used properly and consistently, they're 98% effective in preventing pregnancies. So basically, in 1 year's time, 2 couples out of 100 will have unintended pregnancies using a condom properly. So laboratory studies demonstrated that latex condoms provide an essentially impermeable barrier to particles the size of STD pathogens. These studies show that condoms are effective. Therefore, the increase in their use will prevent unwanted pregnancies and STDs. To conclude, these findings illustrate condom distribution programs can decrease STDs and that pregnancies, and that condoms promoting condoms do not increase adolescent sexual activity, and there's a significant effect on condom use.
All right. Well, Sabina, the problem that I see with the speech is that it's mostly a summary of the particular research that was done in this study, and obviously the inferences of the authors are the ones that you are repeating here. What we need is to be able to generalize beyond the study, and so I think you needed to consult some additional information. Your main proposition has multiple parts to it, and it's like you've got multiple outcomes that you're looking for in the research results in the study. You've got multiple null hypotheses that are being tested there, and you're just kind of outlining what those are in that particular study. Now, here's the thing. The study sounds like it's pretty solid, and you've got good information in the study that you refer to support the inferences or the conclusions that the study arrives at. But basically, the argument is now about the quality of this particular research and its applicability to other situations. Excuse me. We talked a little bit about chain arguments. Since your argument is entirely dependent upon that one study, then flaws in that study become something that could be problematic. For example, I don't know what kind of research has been done on it, and there almost certainly in the medical literature there'll be criticisms of the methodologies and the results. So if you had a broader amount of information that you could rely on, I think the inference would be a little bit stronger. I like the opening that you have where you try and give it a context where everybody in the audience can relate to the subject. Your secondary structure, mostly though, seems to reflect the structure of the study instead of the inferences that you're trying to make. At the end, I did think that you did an okay job trying to show the impact of having access to condoms to reduce the problems that are going on. Some of the statistics in the middle, though, you present a lot of those statistics, and I'm not sure what the value of that information was. Some of them I'm not sure if they were statistically significant. 58% to 60%, 51% to 56%. It got a little convoluted in some of those details, and that's why you need to have clear declarative statements that you're supporting using the study instead of simply outlining what the study says and then giving us the declaration of what that means. All right, thank you. I appear to have run out of speakers for the evening. I've already collected the outlines from people who are day 3 speakers, right? Okay, then I am done with you for the evening. These things will be posted sometime tomorrow, so those of you who are speakers tonight, you'll have access probably tomorrow afternoon.
You did not collect mine. I'm a day 3 speaker.
It's coming a little late?
I don't have it with me.
You don't have it with you. You need to email it to me so I can see it, although apparently you want to double check and make sure that I get it because we've had a couple of people who had problems.
I will double check. I'll send